When we talk about diabetes, we usually mean high blood sugar levels. 1 in every 10 people around us has diabetes, which is a major cause of blindness, heart attack, and stroke. People with uncontrolled diabetes typically live 10 years less compared to the general population. Early detection and effective management are crucial, which is why I will tell you about early signs and symptoms of diabetes that has almost 90% accuracy, along with the effective management and prevention tips. The first symptom of diabetes is increased urination. Because excessive glucose in the blood is toxic and our kidneys try to clear glucose via urine, therefore urine production is increased. Peeing 7 times per day is considered normal. More than that can be alarming symptoms. The second logical symptom is increased thirst. Because our body tries to dilute excessive glucose with water and we lose more water through urine, which is increased thirst as a compensatory symptom. The third symptom is excessive hunger. Despite high glucose levels in the blood, the glucose does not reach the cells and cells experience energy deprivation, making a person feel constantly hungry. As a result, the person overeats. The main question is why there is excessive glucose in the blood and why it can't reach the cells. The answer on this question is the whole idea of diabetes, and the answer is insulin. Insulin is a hormone required for glucose to enter cells, like proper key for the door to open and enter. Diabetes develops if there is no insulin, or there is insulin but the cells don't accept it, like the wrong key to the door, and in a result glucose accumulates outside the door or in the blood vessels. This process is gradually developed over years. At first stage, this excessive glucose is converted to fat and person gains weight. That's why most people diagnosed with diabetes in most cases are overweight or obese. Therefore, obesity can be earliest sign of future diabetes. When diabetes already occurs, some people paradoxically, despite increased eating, lose weight. And its fifth sign of diabetes, unexplained weight loss, happens because cells experience deprivation of energy and body starts to burn its own fats and muscles. Here is another important question. Why excess glucose is a problem at all? Because it's main food for cells. But excess glucose is a toxin. Excess glucose binds to proteins and fats in a process called glycation, forming toxic substances which cause inflammation and oxidative stress, damaging tissues over time. Glucose damages nerves and causes neuropathy, damages kidneys and leads to nephropathy, damages eyes and causes retinopathy, and even damages cells' DNA, which can cause cancer such as breast cancer, colon, liver, and including very insidious pancreatic cancer. There are 2 types of diabetes, type 1 and type 2. Type 1 occurs at young age and always requires insulin injections. Most type 2 diabetes cases don't require insulin therapy. Fortunately, prevention of diabetes is possible in most cases. First, choose low glycemic index foods. These include whole grains, legumes, and most vegetables. Minimize sugar and processed foods. Eat small to or moderate portions to control blood glucose level and focus on fiber-containing foods like beans and legumes, nuts and whole grains. Most green and fresh vegetables are diabetic friendly. If you are unable to consume these vegetables and nuts whole, blending them and consuming as a smoothies is a good idea, especially in the morning. The main principle creating smoothie is that it should be high in fiber, protein, and healthy fats, for example, spinach, banana protein powder, and milk. Second crucial pile is physical activity. Exercise is recommended at least 30 minutes per day, more is better. Third component is weight loss, which is a very crucial and well-evidenced method of prevention and managing of diabetes. 90% of people with diabetes are obese or overweight. Weight loss 10% of body mass dramatically improves blood glucose levels and diabetes. These above-mentioned methods prevent diabetes in most cases and manage diabetes up to 30% of cases if it's already developed. But when medications are needed, metformin is considered the first-line treatment. It is safe in most cases. For people with significant obesity, bariatric surgery can be cure for diabetes in almost 70% of cases. In rare cases, diabetes requires insulin injections.